ahead and hit record. And that time, Dr. Paycheck, it didn't give me the option to record to my computer. It just went. So it should be.
I'm sure we can find those links later.
Okay. All right. All right. So just like you've experienced in other sessions, let me help us get started. Welcome to Mental Health and Correctional Officers, Advocacy and Action for Self-Care. I will be your room monitor, and I will let the presenters introduce themselves in a few minutes. But before the presentation starts, I'd like to remind attendees of a few important points. This session will be 50 minutes. We'll be offering CEs for those who registered with the CE option. We're required by NBCC to take attendance and verify that those requesting CEs attended. This means that you will need to keep your video on for the vast majority of the presentation. So thanks for your understanding. And we will have captions on and be recording the sessions. Please keep this in mind when it comes to making comments. I'm here to help you if you have any questions or issues during the presentation. However, if the question is related to the presentation itself, please express this to our wonderful presenters. With that said, thanks for being here.
Thank you. Hello, everyone. We just want to begin by introducing ourselves to you. Kelly, will you introduce yourself?
Sure, I'm Dr. Kelly Roth, and I am a faculty member at Commonwealth University and also department chairperson of the Department of Anthropology, Sociology, Criminal Justice, and Social Work. But I'm also a student in the CMHC program.
What a unique opportunity to be in both roles. Yeah. We're in a couple of different hats, and that's a mouthful, Kelly, that department. That's really big. Yeah. Hi, everyone. My name is Dr. Ashley Paycheck. I also go by Dr. P. I am a core faculty, associate faculty in the CMHC program. I'm also the assistant department chair for the Department of Counseling and Educational Leadership. Not as long of a name as Dr. Kelly Roth has that she's spearheading, but I'm really glad to be here with all of you. We see a lot of familiar faces, which is really nice, especially some faces I maybe haven't seen as recently. My interest in this topic, well, really came from these two and said, hey, would you like to collaborate with us? And I think this is a special community that is well underserved. My little bit of connection to this topic, even though I haven't had the honor of working with our correctional officers, is I've worked with militaries and veterans. And as you may hear from some aspects of the presentation, there's some parallels and some similarities there, obviously some differences. But that was kind of the two reasons that brought me here. So I'm glad to share the next 50 minutes with you all.
Thank you, Dr. Paycheck. My name is Nicole Paulman. I'm also a student in the CMHC program at Commonwealth University. I have an educational background in psychology and administration of justice from the University of Pittsburgh. I've worked closely with incarcerated and formerly incarcerated individuals over the last 15 years. I'm a community advocate here in Delaware County, just outside of Philadelphia, for prison reform, and I'm a supporter of restorative justice initiatives. Before we dive in, we kind of just wanted to get a feel of where people stand. If you've ever worked in corrections or with correctional officers, or you have a personal connection to corrections workers, could you do a thumbs up, react, or raise your hand just so we can get kind of a picture? Okay, so there are a few people. Great. Thank you. Oh, my screen sharing paused. I don't know why. There we go. Okay. So in case you aren't aware, the role of a corrections or correctional officer, also known as a CO, is to supervise people who are being housed in various types of correctional facilities while they await trial, or serve their sentence. So COs are, sorry, my screen shares, I'm not sure what's happening. They're tasked with keeping individuals in their care safe, compliant, and orderly. Every single day, COs have the potential to encounter extreme violence, fear of contagion, unpredictable, extensive working hours. Taken together, this environment can lead to direct or vicarious forms of trauma. Furthermore, they are faced with myriad barriers to caring for themselves due to many factors we'll discuss today. This lack of self-care can harm the individual CO, their family, and also the people they supervise in these secure facilities. Today, Kelly, Dr. Paycheck, and I will touch on the current state of lacking self-care for COs and its effects. We'll talk about some evidence-based strategies for this particular population and how we as helping professionals and concerned citizens can advocate for wellness in correctional officers, their families, and incarcerees under their care. Okay, so if you're willing and able, can you take a moment to share what you know or what you envision could impede a CO taking care of themselves? So you can click this link. There's a code, the QR code. I'm going to get us over to the little Mentee and see if we can see some responses coming up. I'm seeing lack of time and energy, believing in the process, overworked, long hours. Yep. Stressful situation, overwhelming stress. Yeah. Stigma. All of these things. Excellent. Yep. Great. Well, thank you. And these are pretty much what we'll talk about today. All these things are impacting individuals who choose to work in this field. And we really do want to talk about how can we better support them. So let me get back to my presentation. Thanks for your patience. Okay. Sorry. Sorry, are you seeing the full presentation? Okay. All right, thanks. Okay. So some of the challenges to self-care are exactly what you all said. So I want to first look at some of the most pertinent to consider. So with physical health. So correctional officers face many challenges to their physical wellness. They might not feel safe at work. The populations they supervise often have mental health concerns and challenging histories. Some COs have very demanding, physically demanding shifts. They're standing and moving, applying restraints or breaking up altercations. Others are sedentary when they're monitoring surveillance systems or controlling security systems and door locks. And really, due to the exhaustion on both ends of the spectrum and their unpredictable work hours, they just might not have energy outside of working hours to participate in family or community events or personal hobbies. When we look to shift work and mandatory overtime, unlike law enforcement officers, COs often work up to 18-hour shifts. Some institutions have mandatory overtime that looks like 24 hours in any given pay period. And due to staffing shortages, some COs may be required to stay an additional 4 hours at the end of their shift. So they might feel like they're done their shift, and then all of a sudden, oh, we're short-staffed, so you have to stay for another 4 more hours. Related to these work requirements, the COs report physical symptoms like stomach problems or lack of sleep, reduced quality of life, heart disease, health issues like diabetes, depression, anxiety, reduced immune function, and even irregular menstrual cycles. These extended working hours reduce the time, like I said before, that COs can spend on leisure or with their family or friends, which we know impacts wellness. Certainly, like we said before, as someone talked about stigma. We know that there are preconceived notions about correctional officers. Unfortunately, these common narratives contribute to the stigma surrounding wellness behaviors. Referenced here in their article, Frost describes at length reports of stigma related to reporting mental problems. There's fear of being perceived as weak and losing their jobs, as well as concerns about being harassed by the incarcerated people and fellow staff members. Additionally, there's reports about lack of support for personal problems and really the idea that a CO just needs to suck it up. There's a common phrase, the common CO phrase that I came across called 8 and the gate, which means that you're supposed to just leave behind whatever happened during your shift and move on. Even if that were effective or you could do that, it sends the message that COs who have trouble working through the trauma of their day are somehow not functioning well as correctional officers. Overall, these generalized strengths such as toughness are considered paramount, while a CO who seeks mental health treatment is viewed as weak or ill-equipped for serving in this role. In their study, Johnston et al. Reports that COs have had disciplinary repercussions and experienced fear and guilt for using sick leave for mental health and self-care reasons. You know, generally, there's this lack of comprehensive supportive resources to major stressful events that occur in the workplace. This can make those after effects worse, which lead to anxiety, depression, or even PTSD. When we think about the environment in which correctional officers work, we know that there is exposure to assault, drug use, various bodily fluids, fights, other mental health concerns almost every day. Therefore, we have to have an awareness of like the cumulative effects of experiencing traumatic events firsthand or even witnessing trauma. I also want us to consider, how does lack of sunlight, lack of adequate heating and cooling affect someone's wellness? It's been found that these inadequate working conditions like pest infestations, unsanitary spaces, high noise level, all lead to deteriorating health for COs. This study found that the worse the working conditions were, the more sick leave officers took. And they also increased their use of alcohol and tobacco. They had physical symptoms like those headaches and stomach pain that we talked about, and also trouble sleeping. It's more COs with the worst working environments were more likely to grapple with interpersonal and financial issues. Corrections officers may not have long enough meal breaks to prepare and consume healthy food. And all of those things have an impact. This last little rectangle here, I wanted to highlight that there is a dearth of information about the experiences of female identifying correctional officers, and that highlighted for us an important area of concern and research. Now, Kelly Roth will share some data regarding the prevalence of severe mental health concerns for the correctional officer.
Thanks, Nicole. So correctional officers are human, of course, and the human brain was not designed to handle the exposure and the challenges that Nicole mentioned in some of her previous slides. Correctional officers are in the constant state of fight or flight. Shields and colleagues in 2023 reported that correctional officers and other corrections employees are routinely exposed to events that could cause psychological trauma and are associated with mental health disorders. Unfortunately, the correctional officer subculture does not promote self-care and help-seeking behavior. When we're discussing correctional officers, I want to clarify that this includes all correction officers, those who are employed in the Federal Bureau of Prison Systems, state departments of corrections, local jails, and even for-profit private prisons and jails. Correctional officers employed by the Federal Bureau of Prison and state correctional institutions often have access to more resources than those employed at the local and private jails and prisons. A prison I just want to clarify the distinction between the two here. A prison is a facility where an individual who is sentenced to serve greater than a year of incarceration will likely be housed during that incarceration. And a jail is a facility where someone who is awaiting their trial and sentencing or those who are sentenced to less than a year of incarceration will typically serve that time. Sorry. The correctional officer subculture promotes correctional officers to view themselves as tough and not in need of assistance. They often have a fear that they will appear weak if they seek mental health assistance. This does not vary by type of correctional agency. And according to Riccardelli and Jorn 2021, the stigma towards mental health disorders is widespread in the corrections field. This concern does not only apply to correctional officers in the United States. Shields and colleagues conducted a study related to correctional officers' mental health in Canada. In their 2023 study, they found that 51.4% of correctional officers screened positive for one or more mental disorders. That figure just astounds me. 37.7% screened positive for any mood disorder, and 32.8% screened positive for anxiety disorder. Having 51.4% of correctional officers screening positive for any mental disorder is alarming. This occurrence of mental disorders experienced by correctional officers not only impacts the officers, it impacts their families, those who are incarcerated, and the incarcerated individuals' families, and society in general. Additionally, this topic is often not addressed or addressed very minimally in criminal justice curriculum and textbooks. So one goal for my career and combining these two fields is to increase awareness and to advocate for correctional officer mental health and wellness. Furtick and Pickett in 2024 also examined for prevalence of mental disorders among correctional officers. They found that 26.7% met the diagnostic criteria for depression, 5.7% for alcohol use, and 19.9% for PTSD and 19.5% for anxiety disorder. Again, these rates are alarming and can help us understand some of the mistreatment of inmates that occurs in prisons and jails. It's not excusing that behavior because clearly it's never acceptable, but sometimes I believe that the mistreatment is not purposeful and that the individuals respond because they themselves are mentally unhealthy. Johnson and colleagues in 2022 reported in their article, Improving the Mental Health of Correctional Workers, Perspectives from the Field, that PTSD is a common diagnosis in the field. They also reported that agencies that lack supportive leadership and implementation of quality debriefing programs may be related to higher instances of PTSD. Next, we're going to watch a short video on a former correctional officer who speaks out about his experience with PTSD. As you watch this, notice that he will mention that he believes a lack of quality leadership and assistance was one thing that led to his mental health decline. And this video is from Canada, but again, not very many differences between what he says and what occurs here in the United States. Oh crap, we can't hear it.
Yeah, Nicole may have to reshare, and then when you share the slides, I think you'll have the option. Mine is updated. There's two little boxes for audio. I always click on them. I don't know if one is better than the other.
See if I can get that video.
Yeah, and while she does that, I was just kind of curious. I could tell what Kelly thought. I'm curious, when you saw those stats about the mental health needs, is anyone surprised by these? Do they seem higher or lower? Marceline, what were your thoughts? I saw your hand go up.
Well, it's astounding, I think, as Dr. Roth said, and it's very concerning. And I did a little bit of volunteer work. I won't take up too much time. I did a little volunteer work in the local prison, but my focus was the imprisoned people, not the COs. But clearly, there's massive call for healthcare for these people.
For sharing.
I almost wonder if it's underreported, like
Yeah.
if
The stigma.
and
Basically,
Dawn,
have a brain injury, like
cool. Yeah.
to think about suicide all day, every day.
Derek McLean from Steinbach, Manitoba had been working as a prison guard for 4 years. He's witnessed things that many don't have to on a regular basis.
Like I've been told, like, well, that's what you signed up for. That's the job you signed up for. I didn't sign up to basically, have a brain injury, like to think about suicide all day, every day.
Derek McLean from Steinbach, Manitoba had been working as a prison guard for 4 years. He's witnessed things that many don't have to on a regular basis, and the high-stress work environment has taken a major toll on him, both physically and mentally. Now he's sharing his story with City News in the hope that others in the same situation get the help they need.
Sorry.
McLean has been on permanent disability
Yeah, it's back to her.
on a regular basis, and the high-stress work environment has taken a major toll on him, both physically and mentally. Now he's sharing his story with City News in the hope that others in the same situation get the help they need. McLean has been on permanent disability since September after working inside the Manitoba Youth Centre, the province's largest youth corrections facility. During that time, he says his mental health issues escalated. He was assaulted and threatened by inmates. He witnessed inmates cutting themselves, and at times he had blood and flesh thrown at him. He says unless you've worked there, it would be hard to understand what goes on inside the jail. Over the years, his work took him to a very dark place, and it resulted in him trying to take his own life.
I think they said about 100 pills, poured a jug of gasoline on myself and lit myself on fire. I was just done.
McLean survived, but his story isn't out of the norm when it comes to what first-line responders go through. According to the Center for Suicide Prevention, first responders, including corrections officers, experience post-traumatic stress disorder at twice the rate of the rest of society. And the Tima Conter Foundation, an advocacy group for first responders, says between 2017 and 2018, 52 first responders committed suicide in Canada.
The day that I was in the hospital, even, I was confused with another guy, I believe, that worked in Winnipeg, another officer that took his own life that same week.
Shane Slade was a corrections officer for over 10 years in both provincial and federal institutions. He took his own life this year. His longtime ex-girlfriend, Susan Garrity, says she was shocked to hear of the tragic news, but she believes there were warning signs that Slade's mental health was rapidly deteriorating as a result of the work he was doing.
He called me the night that he was attacked by an inmate with a needle when he was upset, and he had told me that he had tried committing suicide 5 months prior.
According to Garrity, Slade sought help and counseling, but she wonders why those working at the prison didn't notice what was happening with him. City News asked Correction Services Canada what the short and long-term mental health supports are for its employees. They sent a statement that reads in part, CSC recognizes the challenges associated with working in a correctional environment and is committed to providing a workplace that is conducive to the health and safety of all employees, including their mental health. We actively encourage our employees to seek assistance in dealing with any work-related or personal problems that may affect their well-being.
There should be more support, even just like in the jail itself, for after like incidents, and like not just kind of like, well, let's go back to work.
In Winnipeg, Mark Neufeld,
Thank you for
City
getting
News.
that worked out for us, Nicole. And so he mentions that there needs to be more assistance after the incident. So we're going to talk about that in a few slides coming up. And I also just think it's important to point out that he worked in a juvenile facility. And I know Laura has experience in a juvenile facility. And we need to remember that just because they're juveniles doesn't mean that they aren't capable of some very serious assaults and things like that. So, even a juvenile facility, these individuals who work in those facilities can have very serious concerns. Go ahead, Amanda.
I just wanted to point out too, I saw a CO for a while in my private practice, and one of the big issues that I don't think we take into consideration as much is like how COVID affected COs, because he got COVID very badly, was hospitalized, was on a ventilator, and then got reprimanded for being out of work so many days because he had COVID and was in the hospital because it exceeded their attendance policy. So like, and then having to like suck it up and go back into work where he viewed that environment as a place that almost killed him. And
Yeah.
like, you know, the trauma of that is pretty significant as well. So I just wanted to point that out.
Absolutely. Thank you for pointing that out. And it would be very interesting to look at the statistics, and I don't think they exist, but it would be interesting to see statistics for mental health in correctional officers pre and post COVID. And like Dr. DePalmer said, you know, I think a lot of this is underreported, again, because of that stigma and because they fear for their jobs in correction positions and law enforcement positions. If we're deemed unfit for our job, we'll lose our job. So, you know, definitely some serious concerns here in a population where we need to be providing much more support. So unfortunately, you know, this slide just gives us some additional statistics here. Unfortunately, mental health concerns that remain untreated can result in suicide and suicidal ideation. Suicide and suicidal ideation are not the most prevalent mental health concerns faced by correctional officers, but it's the one that too often results in the death of the officer. And as you heard in that news clip, there was one officer who did complete suicide, and then the other officer who had attempted suicide. The table in this slide was obtained from Frost and Montiero's 2020 article, The Interaction of Personal and Occupational Factors in the Suicide Death of Correction Officers. Access to firearms, relationship issues, and substance abuse issues were the most prevalent risk factors for suicide among those who died by suicide. Other researchers, including Morgan in 2009, reported that stress experienced by correctional officers can lead to high rates of severe depression and suicide. Go ahead to the next slide, please. So there is an organization that was originally known as Blue Help. I am actually acquaintances with Karen's Rodwell Solomon. She is one of the co-founders of the organization. They began collecting suicide statistics among law enforcement officers in 2016. The organization has expanded to collecting suicide statistics among the first responder groups, such as correctional officers, dispatchers, EMS workers, and firefighters. The organization is now known as First Help, and anyone is able to go to their website and submit the information on a suicide completed by a member of any of those mentioned professions. The suicides are all verified before they are posted on the website. Therefore, some of the numbers may not be immediately available. For example, as you can see, there are only 2 reported correctional officer suicides for this year, but we anticipate that that number will rise as friends and family members of those who completed suicide learn of this organization and voluntarily report the suicide. Just recently, the FBI and the Department of Justice began collecting this information, but it is still not mandatory to report first responder suicide. Therefore, we do not know how many completed suicides are not captured by these statistics. Since 2019, there have been 121 reported correction officer suicides. The average years of services of those who completed suicide was 11.993 years of service. 57 of the correction officers who completed suicide were also military veterans, and the majority of the completed suicides among this population were male. Little is known about the difference in gender related to correctional officer suicides, but according to Zippia.com, approximately 62.5% of correctional officers are male and 37.5% are female. So we would expect to see a few more or a higher percentage of females completing suicide in this population, but they're not. So more research needs to be done to examine and look at correction officer suicide. Back to you, Nicole.
You're on mute still.
Thank you. Thanks so much, Kelly. We can't help but wonder why PTSD and suicidality are so common and prevalent for this population. Some reasons seem obvious given the working environment, but others are not so obvious, but they have an impact nonetheless. Knowing that correctional officers are barraged with these concerns on a daily basis, let's look at how this may affect their ability to fairly, equitably, and ethically and safely perform their job duties. So it was found in this study by Worley et al. That some correctional officers were more likely to treat incarcerated people cruelly and be negligent in reporting acts of abuse. This study found that those who exhibited these behaviors were earlier in their careers. They largely identified as male, and they often expressed work dissatisfaction. This group was also less likely to have strong connections with both family and their supervisors. And that kind of goes hand in hand with what Kelly said earlier about other ongoing mental health concerns affecting performance at work. Peterman et al. Looked at the internal belief system of correctional officers. These belief systems were found to have been influenced by factors such as individual personality and also racial bias, as well as level of training and the institution's policy on procedural justice. So COs who were more agreeable and had solid policies within their organization for handling stressful situations were less likely to behave punitively toward incarcerated people, whereas those with racial bias were more likely to treat people inhumanely. The workplace concerns that exist for COs also exist for the people being housed there. We can surmise that the same stressors that affect COs also affect incarcerated individuals. This may be just one of the reasons why staff-incarceree relations are so fraught. So how can we support these populations so that all involved in the prison industrial complex are treated as humanely as possible? The National Institute of Corrections in their 2021 presentation suggests that when COs are well, they have a greater ability to change the way they view the individuals for whom they are responsible. For example, instead of seeing an incarcerated person as manipulative, they can view that person as one who has experienced trauma and really needs support. Or instead of an officer taking out their frustration on an incarcerated person, COs can learn through training to not respond defensively and instead turn on that empathy for the individual. These seemingly small changes have shown to improve wellness across the board, from prison staff to those who are being housed in prison. So what are some evidence-based strategies that we can employ? The study by Johnson et al. That Kelly mentioned earlier that asked CEOs how their mental health could be supported at work. 4 main themes emerged from this survey. CEOs need reliable, ongoing, on-site access to mental health care for professionals who are trained specifically to work with CEOs. And I think that was really reflected in the video from that corrections officer. The second was modify the institution's work shift protocol to one that offers predictable and reliable scheduling to ameliorate those work-life balance concerns. Also, better interpersonal communication between supervisors and staff. And finally, allow physical spaces within the workplace where officers can seek reprieve to take care of material and mental health needs. For physical wellness, the authors recommend an on-site gym and kitchen access. Other articles about this topic reinforce the use of high-quality mental health counseling, as well as other methods such as meditation and massage. Support in time management, ensuring nutritious eating may also support wellness. And there was one more source that highlighted yoga as a method for helping COs maintain their well-being. In this study by Radcliffe and Pollock, they discussed prioritizing trauma-informed yoga for correctional officers due to their near constant state of stressful arousal. In trauma-informed yoga, the instructor does not offer any hands-on adjustments. Instead, they combine gentle and encouraging direction for the CO to notice various muscles in their body and stay existing in the present moment. The authors reported an overwhelming, nearly 100% support for this type of yoga from corrections who completed this one-day yoga training. Here in Pennsylvania, the York County Jail incorporates trauma-informed yoga in their regular CO training. For incarcerated people as well, trauma-informed yoga has benefits. Those participants showed higher levels of self-acceptance, personal responsibility, and a sense of purpose.
So there are many things that we can do to help our correctional officers, but three of the ones that I've identified, and due to time constraints, we had to limit it to three. We have peer support. So I'm actually a trained peer support person for law enforcement, but it doesn't mean that I can only be a peer supporter for law enforcement. In Pennsylvania, anyone trained in peer support has the same ability to maintain confidentiality and not share that information with the individual's employer. And so as a trained peer supporter, I can provide that same support to a correctional officer, EMS worker, dispatcher. So in Pennsylvania, our law kind of covers all of those. Corrections One is an organization that puts out a lot of training and articles for correctional officers. And they have a 2019 article written by Dudley on the 6 steps to building a peer support program in corrections. And the steps are confidentiality. Confidentiality is critical. So any peer support program that we implement, we have to make sure that the individuals are going to maintain that confidentiality. There has to be administrative support. So the leadership and command staff must have buy-in, and they must not attempt to force a violation of that confidentiality. Step 3 is professional mental health, professional support and guidance. So there should be an LPC who oversees the program and provides support and guidance to the peer supporters. Step 4 is personnel selection. So we have to select people to be peer supporters who have been deemed credible, competent, and trustworthy, and free from their own current struggles. And I say current struggles because sometimes it's good to use someone in these roles who have had struggles in the past and who have kind of overcome those struggles and who are now well, because that shows a correctional officer that, hey, yes, I'm struggling, but there can be a positive end to this situation. And then there has to be training, ongoing training. So this also is where licensed professional counselors can come into play, because they can provide that training and support to the peer supporters. And then there has to be a review and audit of the program. So the program should be reviewed as necessary to maintain its effectiveness. The use of chaplains is another potential opportunity for providing support to correctional officers. According to their website, the American Correctional Chaplains Association was established in 1885. They offer a certification as a correctional chaplain. Correctional chaplains do serve the needs of those who are incarcerated, but they could also serve the needs of the correctional officers. Spiritual self-care is one of the self-care dimensions, so it is imperative that we have services available that address all of the aspects of self-care, especially since many correctional officers work shift work, weekends, holidays. They're often limited in their religious services they can attend, and providing access to services that address all of the self-care dimensions is imperative to a holistic systemic approach. Critical incident stress debriefings are also important, and this is what the officer that we saw in that video was kind of mentioning, that more support, more services like critical incident stress debriefings would have helped. So Johnson and colleagues in 2022 reported that agencies lack implementation of quality debriefing programs, and that may be related to higher instances of PTSD. According to Davis 1994, critical incident stress debriefing is a group process that was developed by Dr. Jeffrey Mitchell in the 1980s to help responders deal with critical incidents. CISD can prevent negative long-term impacts that can result from critical incident exposure. A formal debriefing should occur within 72 hours of the critical incident, and a follow-up session could also be included as part of the process. In order to be effective, the debriefing must follow specific guidelines. Unfortunately, we've seen in cases where the debriefing does not follow the evidence-based methods, it's actually had a detrimental effect rather than a positive effect. But this is another area where licensed professional counselors can help in these institutions, because often they're the ones involved in running the debriefing. The different steps of the debriefing are the introduction phase, where the ground rules are set, the fact phase, where participants tell their story from their viewpoint, the thought phase, where participants share their thoughts about the critical incident, the reaction phase, where participants share their feelings. According to Bryant 2012, research results about preventing PTSD through inoculation or programs like CISD are not confirmed, but a mixture of treatment debriefs and other inoculation efforts are likely to be the most effective. There's also the symptom phase, where they share how the incident has impacted their life, such as are they having difficulty sleeping or other signs that they're having trouble dealing with this. And then the teaching phase, where the team, which should include the clinician, reassures the group that their reactions are normal to an abnormal incident. And then the reentry phase, where the group asks questions and there's a summary of the debriefing.
Okay, so we have about 9 minutes or so. So I'm going to probably speed things up here. I was just reading the chat box, and I'll touch a little bit on that. I know Nicole's already talked a little bit. Kelly's talked a little bit about the stigma. One of the other, what I think is kind of a neat evidence-based practice for addressing the mental health need in our corrections officers is that of therapy and trauma dogs. I think, and when I read this in the research, I was like, oh wait, I personally get confused on service, therapy, trauma dogs. So I think it's really helpful to start at the very beginning. And so thinking, okay, what is a service dog? And so those are trained dogs that help people with a wide variety of different disabilities. And that may be medical, and maybe even mental health based. So medical, you know, when I think about a service dog, I think about maybe a service dog helping someone that is blind to navigate, you know, their surroundings, or maybe even someone that is deaf, maybe alerting them when there's something, you know, that they can't hear, maybe pulling a wheelchair and so forth. But like I mentioned before, it can also, there's also service dogs to help with mental health needs. The neat thing about these particular animals is that they're protected by the ADA. And so these dogs can go pretty much anywhere. They can't be prevented from going into public spaces like restaurants, hotels, and stores. The caveat there is that they're often, I don't know about you all, but I always have to stop myself and my young children. We don't touch, we don't go up to those dogs because we don't want to interfere with basically their job because they're working. Now, therapy dogs are essentially what they sound like. They're therapy dogs. They're to help provide emotional support to different people in a lot of different settings. You may see them in hospitals, retirement homes, schools. And so they're not quite the same as service dogs, and they don't get the same privileges as service dogs into going into some of these public places. I know that was a big change here at one of my local restaurants is, you know, the change between service dogs and therapy dogs. And, you know, there was some frustration, I think, by the community on that. The thing with therapy dogs and trauma dogs is people are typically, not always, but typically encouraged to interact with the therapy dogs and trauma dogs. The other part, so trauma dog, that's what a lot of the literature says is supportive for RCOs. They're trained specifically in providing comfort and relief to people who have experienced trauma. And so you may even see these right in other helping professions, like police officers or veterans or active duty members. So often just these dogs' presence can help build rapport and trust with the people if they've experienced some sort of crisis or traumatic event. The other neat things, like up on the slide, They talk about how they can help prevent or provide, a calming effect in a stressful situation, or just a calming effect for someone that maybe has experienced some of that trauma. They can also utilize pressure points to increase blood pressure and heart rate. And they can also help assist in this grounding through leaning and weight during a panic attack or a post-traumatic stressful situation. So we're going to wrap this up with two things. I'm going to move quickly through advocacy, and then we have some resources, and I'll try to, if we have time, to touch on them. The PowerPoints will also be available. You can email myself or Dr. Pytel as coordinators of the conference if you would like PowerPoints. What we're going to do is we wanted to wrap up with advocacy and action. We look at 3 different levels of how can we advocate. And so we can advocate, at the community level, organizational level, and the individual level. And as I went through a lot of this and a lot of the resources and literature that's out there, I noted a lot of barriers with some of this. So maybe keep that in mind as I talk through them here just briefly. So looking at the community level, this can be smaller. So it can be within, our counties, our states, or even nationally or globally. As you can see up here, there's some international working groups as well. So we can get involved, our officers can get involved in lobbying, meeting with our legislators, attending different citizen input meetings, maybe different state or county meetings, or even international working groups. And this is a great place to advocate for different subdiscipline specialties for mental health treatment for our COs. At all the different entities, really advocating for that increase in salary, benefits, workplace conditions. An example of this, because as you probably gathered, I'm from Colorado. So the Colorado Department of Corrections, or the DOC here, they actually host a citizens advocate meeting 2 times a year, where that allows the community to come in and get information from the DOC. They actually have to report that to the community and to its stakeholders, and then everyone kind of gets a voice there. And this is a great opportunity to advocate. There's also surveys and listening sessions. And so these, again, are just used to facilitate discussions where different perspectives can be shared, experiences, different ideas, and so forth. Okay, so looking at the organizational level, and when I was thinking of some barriers and listening to the presentation earlier, this is kind of really what stuck out to me, because I think this is their own culture. And I think sometimes it's really easy to be stuck in a culture. So when we look at advocacy at the organizational level, we're looking actually within the correctional facility itself. And so, like I said, there's obviously some challenges in doing so, and that are embedded so deeply into the facilities. A few of the ideas, and these have kind of been touched on already, is different training on mental health. So thinking about including it more, if it's not already in the onboarding process, but integrating it frequently to the COs themselves. And that could be psychoeducational groups on some of the same things that we've covered here, or they could be even more specific types of groups on teaching about self-care, different warning signs, some of the challenges and barriers and way to overcome them with some of the mental health aspects that we've talked about here. This kind of ties into also the next one about mental health check-ins and access to mental health counselors. So, if not having mental health counselors almost like embedded in the facilities, having a contract with licensed professional counselors, advocating in the correctional facilities that the COs have more access to these counseling services. When I worked as a military counselor in a school, they had all different kinds of positions, and some of those were actually embedded in units in the military. And right when they would come back from deployment, noticing we're almost out of time, when they would come back from deployment, they all were required to do a mental health check-in with a licensed professional counselor. So just real quickly moving through, also considering different support groups, wellness programs. I'm a big advocate. I experienced this when I worked in a residential treatment facility on moving away from sick days and advocating for mental health days. That really helps remove the stigma. It even removes the position for CEOs to be in a place where they have to lie and say they're sick when really they're just burnt out and they need a day to recover. A big part of it, I think that is a big barrier, is advocating and addressing some of the stigma and some of the retaliation that happens for our CEOs if they are experiencing mental health concerns. For the sake of time, I'll move on to the next one. Here's a couple different ideas, or will be a couple different ideas of how to get involved at the local, state, national unions. So actual unions themselves. There's a couple different examples. There is a National Corrections Employee Union that any correctional officer can get involved in. And then you can see below the Pennsylvania State Corrections Officer Association, which has been around really for quite a long time. And then looking at resources, here's some great resources, anywhere from an EAP program, how CEOs can find and sign up for a backup buddy. That's one of the service pets that we were talking about. Again, if you want to reach out and ask for these PowerPoints, we'd be happy to share all of these links, as you can kind of tell in the PowerPoint, within the exception of an EAP. They all have links embedded in them, and we would be happy to share that with you. And then we were going to end. I know we're out of time, but if there's any kind of final thoughts or questions as you listened to the presentation, any kind of final thoughts or questions or comments you had?
I just wanted to say, excellent job. I am buzzing with questions, so I'll probably email some to you. But the only real question that I think could be answered quickly is, are there any books or long form documentaries about the experience of CEOs in America that you might recommend?
Not off the top of my head, but
Yeah.
I'll or something.
Yeah, I didn't come across any, so I don't know. There are, I know, for people who are incarcerated, there's a lot. There are many things you can view. I don't know. That's an excellent question.
Time to say one thing real fast. Becky, hi. I just want to say, well, A, that's really telling that there's no book about that. But also, as I was listening to the presentation, you know, the first half, it is, you know, it's discouraging, right? Things, you know, how hard it is for corrections officers and being in that environment. So my mind always goes to, you know, this environment shouldn't exist. Like, it's unhealthy for everybody, right? On both sides. But it was very encouraging to hear that there are interventions, you know, because we're not going to get rid of the prison system right now, but these are things that we can do, right? That actually would be helpful. So it was just really encouraging. I really appreciate it. It was a great presentation.
Thank you, Becky.
And just to piggyback off of that quickly, I think it is very encouraging and exciting that we're having these discussions as far as just increasing the mental health awareness of the CEOs and things like that. I know in my area, there's been some outreach more than usual about the mental health population in the jails and things like that, and how the community can help them within the jail system itself. So I'm very excited that I seem to be hearing this conversation more, and that there's some options that can be implemented. So it's exciting. So thank you for this presentation.
If anyone wants to help write a self-care for the criminal justice professional book, contact me. I'd love to write that book.